We are speaking less than a week after the worst earthquake to hit the region, to hit Myanmar in nearly a century. Can you just walk us through the events of that day, that earthquake?
Well, what we've heard from our staff is on the ground in Myanmar is similar to what we've heard from our staff in Turkey and Syria and Pakistan back in the day, that it was a normal day. And then the world really did start shaking, and the level of destruction that colleagues are reporting seeing in Mandalay is pretty significant. Houses, major buildings pancake down on themselves, whole bottom floors just completely gone. So major destruction, and the humanitarian consequences that accompanies that level of destruction. So very significant loss of life, about 2,000 at the moment, and then numbers to be confirmed in terms of number of people who've lost their homes or have otherwise been impacted. But we're basically planning for tens of thousands of people who will have lost their homes as a result of this.
So, you mentioned you've been working in international humanitarian response for at least 23 years with the IRC. How do earthquakes as a natural disaster differ from other types of disasters, say a cyclone, a hurricane, or even a man-made natural disaster? Are there like qualitative differences in both the
Mm.
kinds of destruction wrought and the like way the international community responds in these types of situations?
It's a good question. I would say that there are, in cyclones and tsunamis and other major natural events, the immediate consequences often, I know this sounds obvious, but often involve water in a more meaningful way. So the IRC actually we were allowed into Myanmar for the first time in 2008 following Cyclone Nargis. And our colleagues spent quite a few months with a major transportation medium was rowing in
Hmm.
small canoes and bigger boats, rowing around the countryside to communities that were still underwater. So cyclone tsunamis, the water is a bigger factor, but the level of destruction is the same where major infrastructure is broken, whether it's buildings, residential, commercial, and then roadways, which hamper the aid effort immediately following. Major injuries that doesn't discriminate who gets injured, just everyone is vulnerable to things falling on them. Um, the difference between natural hazards of this kind of rapid onset and then man-made wars, mass displacement, is the threat, although acknowledging aftershocks, but the threat to life is short-lived. It
Hmm.
happens. There's some aftershocks over 24, 48 hours, but then the threat is over, where a conflict or internal struggles that we see around the world, the threat is much longer. So now our staff are still interacting with people who are sleeping outside. That is a normal thing in an earthquake because they're worried about aftershocks and the impacts of further destabilizing buildings coming down. But in all intents and purposes, touch wood, find something to touch wood, the threat is now over. So now the work starts of clean up, debris clearance, stabilizing the people who've been injured, helping families pick their life back up, put it back together again, basically.
So with this earthquake and its immediate aftershocks, you touched on this a little bit earlier, but could you flesh out just the scale of the damage and displacement that we're seeing? And are there like particular regions or parts of Myanmar that are more acutely hit than others?
So this was a big earthquake on the scale of earthquakes. This was a 7.7. That doesn't mean much to anyone who hasn't lived through an earthquake. I've been through high sixes. This is a big earthquake. The epicenter was in Sagaing, Mandalay, somewhere around there. Mandalay is the second largest city in Myanmar, but it was felt as far away as Bangkok. Major buildings came down in Bangkok, lives were lost. So, as some measure of the scale of the earthquake, hundreds of kilometers away, people lost their lives as a result. So the actual impact close inside Myanmar was catastrophic around the
Mhm.
epicenter. And I would say that the type of country Myanmar is and the way construction is done in that part of the world, as soon as you get outside the major urban areas, the housing, the design of the architecture of housing is not built for earthquakes. So as soon as you get outside the city, the destruction is very significant in rural areas.
So you mentioned Sagaing as being really the epicenter of this earthquake, and my understanding is it hit just kind of kilometers. The epicenter was just a few kilometers from Sagaing. Sagaing is also the epicenter of the conflict of the civil war in Myanmar. The civil war erupted in 2021 following a coup that toppled the then fragile civilian led government. There was lots of repression by the junta. I'll say this so you don't have to, as a
Thank you.
humanitarian. Uh, um, but essentially, a civil war erupted over the last several months, I'd say. The junta has been more or less on the defensive, but one of the areas that is very hotly contested is Sagaing, and it is in a country of something like 3 million people displaced, or 3.5 million people displaced prior to this earthquake. Over half were displaced in this one region where the earthquake struck. How do you deal therefore with, like, really it's a crisis layered on top of another crisis?
Yeah. Well, you took the words out of my mouth in terms of the layering of crisis and driver of humanitarian need. I'm glad that you described the situation because it's sensitive for humanitarians working on the ground. But what I can say is the government controls about a third of the country. The vast majority of the country is either contested or fully controlled by the Popular Defense Forces, which is a wide, broad term of the various opposition groups that are operating across Myanmar. I've heard Sagaing described by our leader on the ground, our country director on the ground, as contested. So I'm glad that we're using the same terminology. The impacts there are very severe. We're very fortunate to have been in country operating across Myanmar for such a long time because we have deep partnerships with local organizations who are operating in Sagaing, already working with them, already providing support to them. So it was pretty easy for us to reach out to them to understand what they are seeing, what their plans were, how they're planning to respond, and for us to extend support to them. That doesn't mean that it's easy, though, because the front lines in Myanmar are serious, and getting commodities, humanitarian relief across front lines is currently not possible. So it's basically supporting local organizations based on what they can procure in the markets where they can gain access to, rather than importing anything from the capital.
That's interesting. So you're just not able to, I mean, for obvious security reasons, cross the front lines of this civil war. And
It's
yet, as you said, like the Sagaing, the region hardest hit, is the most hotly contested part of the country.
Yeah. So I mean, there's differing contract contexts around the country where in some places that have been a little bit further away from the epicenter, there are still very significant impacts. They're behind the front line, so it's crossing a front line. Sagaing is more contested, so it's just a security issue. Fighting is continuing across the country, which I'm disappointed with. This is, if there were ever a time for the parties to the conflict to pause. I know the Secretary General is calling for a cessation pause in hostilities. This is the time to do it, where
Mhm.
civilians are looking to whoever is in charge to stop fighting for a while to allow aid in.
So that question about allowing aid in, I think, is seemingly a crucial one at this point. There was aid kind of prepositioned within Myanmar because there, was and is like a humanitarian, ongoing humanitarian emergency as a consequence of the civil war.
Yep,
But the scale of this crisis suggests that more aid ought to be and needs to be imported from warehouses, and people need to arrive
yep.
to just, international staff need to arrive into Myanmar. I guess I have two questions on that. The first is, like, is political in a situation like this, in a conflict. It's often um, difficult or logistically complicated, let's say, to deal with the national authorities to get the right visas and get the right paperwork in order to get aid in. What has been the nature of the kind of de facto government's response at this point? Have they been
Yeah.
working generally with the international community to permit aid in?
So let's keep in mind it's Wednesday. This happened on Friday, so I think it's too soon to tell. One heartening piece of news is that the government of Myanmar, I'm choosing my words carefully as you are,
Yeah,
um, welcomed, invited foreign aid, foreign assistance. To my memory, that's the first time they've done that since 2008 when they invited in last time. We're hoping that that will have positive consequence on visas, which have been very difficult for foreign experts coming into the country. We've been managing managing and benefiting greatly because of the bravery and expertise of our local colleagues from Myanmar. Civil society is vibrant and capable. Our team of national staff on the ground are amazing. So the requirement for expats on a normal day, it's fine. We're managing and flourishing through our national colleagues and national partners. But now people need some help when an emergency of this scale, severity happens. Search and rescue teams, the flow of just aid workers coming in to manage the massive uplift of commodities that are required to help replace just normal day-to-day assets in a home environment. That takes more hands on deck that haven't been affected by the conflict. So time will tell whether the visa regime will be accommodating to allow people to go in. In the meantime, we're making the best we absolutely can with the staff, the brave staff we have. We deployed a mobile medical team, the first of our mobile medical teams, into Mandalay yesterday. It arrived and immediately began serving people, trying to decongest the hospitals by serving primary healthcare and minor injuries outside of the hospital setting, so the hospitals can focus on the more severe injuries. So we're able to do that with just
yeah.
staff from Myanmar. So we're really fortunate.
Let me just sort of emphasize for viewers who are kind of unfamiliar with a lot of the kind of sensitivities around mounting a humanitarian response, particularly in a conflict zone. I have done like dozens upon dozens of these kinds of interviews over the last many years. I can. I understand, and I wanted to convey to listeners that you, as a humanitarian official, um, are constrained in your ability and it just doesn't make sense for you to want to kind of like opine on the politics of the situation because your job is to get aid to people who need the aid, and you need to work with whatever authorities are there and present. And so it makes complete sense to me that you wouldn't want to like discuss these issues, but I just want to make sure it makes sense to listeners as well, because you are a humanitarian. You're not like a political actor. You're there to help the people wherever they're in need. But there is like a layer of politics that informs the ability of you to do your jobs. Things like getting visas, things like getting approval for aid to get into places. So I'll again like say that so you don't have to. On just like the kind of logistics of the infrastructure right now, earthquakes, a sudden onset like this, like is like the airport in Mandalay, the area of the city closest to the epicenter, even like functional at this point? And is there an aid pipeline? For example, I know two couple days ago I caught the press conference from the United Nations aid agencies in Geneva, and the UN has this big warehouse in Dubai. I've visited it. That's like a massive warehouse, acres of
Mhm.
humanitarian supplies in these kind of tin sheds that are just like there and waiting to deploy to the region. Um, like, to your knowledge, like, has that aid been able to get into Myanmar yet, just from a logistical point of view, because
Yeah.
airports are damaged?
Yeah. So just I'll answer that question. Just going back to a point you made earlier about the pre-positioned supplies in Myanmar. We ourselves had a warehouse full of basic household essentials, blankets, pots, pans, buckets, and jerry cans to store clean water, etc. Hygiene kits. We've distributed those already. We didn't have a huge amount because that are huge humanitarian needs on an ongoing basis in Myanmar. So to sit on aid when there's urgent needs for it on any given Tuesday, you've got to get it out the door. So we had to prioritize only holding a minority of the aid so we can give it out. So what that means, and many aid organizations have made exactly the same calculus within such a high need environment. So what it means is, it brings it to your question, we have to bring in huge commodities from regional warehouses. My understanding, I checked on Monday, the airport in Mandalay wasn't working. I haven't checked in the last 48 hours. I'm speaking to our team leader on the ground tomorrow morning, so I'll get an update then. Um, Runways are pretty brittle during an earthquake, so it normally takes a bit of time to get
Yeah.
them smoothed out again. So big, the type of huge haulers that commodities require can land on long enough runways. So my understanding is that it's starting to get in, but it's then requiring trucks to drive it up to the affected areas. And there's not many trucks. So we ourselves are in the midst of trying to find trucks to move our aid around, and
Mhm.
they're in high demand right now.
So I wanted to ask you a more big picture question now, based earlier on, you noted that you'd been working humanitarian emergencies with the IRC for 23 years now. This is the first sudden onset natural disaster that has hit in the wake of the dissolution of USAID and the foreign aid freeze by the Trump administration, by the United States, which under normal circumstances provide really important logistical and financial and sometimes political backstopping to the international response to humanitarian emergencies. Globally, something like 40% of all humanitarian emergency response was funded by the United States. That funding, as far as I can tell, evaporated. I know organizations and agencies like the IRC has suffered, massive funding cuts and have to lay off staff around the world. In these early days, have you discerned any kind of difference in how the international response looks towards this disaster compared to previous ones, with the understanding that the United States is not a key player here?
Yeah, I mean, it's immediate, obvious, and a crying shame.
Can you just like
I've
unpack each of those
Yeah, I'll
issues?
tell you.
Immediate. Why is it immediate?
Well, in every other natural disaster I've responded to, so I started in '99, so where are we now? 26 years. The first group that we call and the first group that we expect to arrive into an environment like this is US search and rescue. The next group that we anticipate seeing arriving is the disaster assistance response, the DART from the US government, which is an emergency team the US government sent out of some of the most experienced, capable humanitarians that I've had the pleasure of working on. They're always on the ground first. They coordinate the delivery of search and rescue, and then they coordinate the arrival of US military flights, bringing in the plastic sheeting, the buckets, the jerry cans, everything at a huge scale. And then they coordinate with local and international organizations and UN agencies who are on the ground and arriving to ensure that there is an injection, and a major injection of immediate funds to empower the humanitarian response. None of that is present for the first time in the memory of all the aid workers that I can remember,
Hmm.
or I know rather. That's just not present. There isn't US search and rescue on the ground. One of the best teams in the world is not present.
Yeah, there's this
Lives have
team right
been
in Virginia that's like on the
yeah,
standby that
there's
deploys
multiple. There's
anywhere, like a
multiple.
world's
Yeah,
notice at a drop of a
yeah,
hat. They have like dogs, they have like just the
yeah.
equipment, the expertise. They're kind of like known as like the,
The
best
best
and
in the world.
brightest
Yeah,
search and
there's
rescue people that are
US
deployed
government
around the
have
world.
the US government have a roster of the best search and rescue teams in the world who are not in the largest natural disaster in the world at the moment. They have one of the biggest, most capable militaries in the world who empty. You think the UN's aid hub is huge? You should see the US government. They have massive resources of what, depending on the circumstances, are life-saving blankets and jerry cans, things that make a massive difference to people's health in the immediate days after a crisis. None of that has been mobilized because there's no one to coordinate it. There's no one to make decisions about what should be flown out and where it's going. And then they've historically had the ability to deploy millions of dollars, tens of millions of dollars, very rapid, not as rapidly as it's sometimes needed, but very rapidly compared to other countries in the world, just gone. And that has had a knock on effect of other government donors around the world who've had to prioritize and reprioritize to try and fill the gaps left by the US government. So it's had a profound ripple effect across the way in which people living in wars and natural disaster zones are supported immediately. So going back to my final clause, it's a crying shame.
Yeah, so in Myanmar, specifically in the absence of this American leadership that historically accompanies the immediate response to natural disasters like this, are there like who's stepping up if anyone?
Well, we've seen search and rescue teams from China, from India, from Singapore. They're the major groups that are on the ground and working around the clock to save lives. Putting aside, which you've excused me from, which I really appreciate it, but putting aside global politics for a moment, I don't care where the search and rescue teams come from as long as they can get the job done and they're there. So I feel really grateful to those contributing nations. The big next question is, where are we going to get the commodities from? Where are we going to get the funding from to make a dent in the need that we see in the tens of thousands of people who've lost their homes in a vulnerable country, conflict affected country? Um, I don't know the answer to that question.
Yeah, I mean, I was looking at the UN's Office for the Coordination of Humanitarian Affairs, their appeal last year in 2024 for funding to support the humanitarian response from the fallout of the Civil War. And last year, the United States contributed about 30% of the total funding. It was like, I think it was like around $1 billion. Not, it was so about $300 million from the United States to support humanitarian response in Myanmar. In 2025, that like about $1 billion appeal, give or take, was only about 4.9% funded as of the day of the earthquake. And with no expectation that the top donor, the United States, was going to step up. So again, we talked earlier about how this is a disaster layered on top of a crisis.
Mhm.
And it seems to me, the humanitarian needs are going to skyrocket, as you said. The traditional leader in this kind of response is absent. So like something has to give, and like what do you think that might be?
Well, optimistically, we'll see other states who have traditionally not been major players in the humanitarian response um, area step up. So it'll be interesting to see what China does. They themselves have massive civilian protection capability, disaster response capabilities outside of just search and rescue. Um, we'll see what nations can do in terms of making contributions to commodities, but that's the optimistic view. The realistic view is that we'll be able to do less. We'll be able
Mhm.
to do um, the basic minimum to save lives, and then we'll just have to stop because we'll run out of money. And the risk here is with the layer on layer is becoming a little bit three-dimensional by including time, but time does matter. The longer people go without getting treatment for injuries, the higher the chance of infections. The longer pregnant women can no longer get access to hospitals because they're full of people with injuries, the higher the maternal mortality will go. The longer that people with non-communicable diseases, sugar, diabetes, high blood pressure, et cetera, can't get access to their normal treatment, the higher the preventable mortality will go. So the sooner we cut off aid, the sooner we run out of money, the higher this tail of humanitarian impact, the longer it will be, the more significant it will be. So it's very, very sad.
So earlier, I referenced layoffs and budget cuts throughout the humanitarian world, including that's hit your organization, the
Mhm.
IRC. Have these cuts impacted your ability to respond to this particular crisis?
I can answer that in different ways. We had a US government humanitarian award in Myanmar that was cut, so we don't have USG funding. So our ability to be responsive using existing resources is greatly diminished by the decisions that were made by the US government. At a global level, no, our ability to respond to emergencies is something that we have protected because we think within a world um, where there are more nationalistic tendencies, more looking in rather than looking out, there's going to be more humanitarian emergencies because there's going to be more conflicts, and we can see that in real time around the world. Conflicts are not being managed, new conflicts are developing, and we will for sure see greater humanitarian need as a result through emergencies, rapid onset, worsening situations. So we have safeguarded our emergency response capability, but by at the same time as doing that, we've had to close country programs. We've had to lay off thousands of staff. So there
Mhm.
are humanitarian crises that are protracted and not in the headlines that we will not be able to engage in anymore because of the way the funding flow has changed, and that's a shame as well.
And that kind of leads me to like my last question. I mean, you do have, as you noted, like so many kind of long, slow burning humanitarian crises
Mm.
around the world. You know, DR Congo, Sudan, South Sudan, that are just like massive in terms of the
Yeah,
numbers of people impacted that are already, like cause a lot of organizations to devote like a lot of resources because that's where like the people in need are, and then you have like a sudden earthquake
yeah,
that just demands resources which now are becoming more and more finite because the largest donor, the United States, is kind of pulling out, in like the kind of constellation of crises and responses that you're working on. How do you like figure how do you determine where to devote resources and how when these resources are becoming more and more constrained? And that's like a question for you specifically to the IRC, but more broadly, how are you seeing it playing out across the kind of humanitarian
yeah.
sector?
Well, I mean, I think the starting point to that answer is a mantra that I've said more in the last couple of months than I've said in the last 20 years, which is we've we're only able to do what we can with what we have. So the resources that we're able to raise, secure from the public, from foundations and corporates, and then from government donors is that's the universe of the aid that we can deliver. And as that shrinks, we need to be aware that talking about doing more with less is ridiculous. We're talking about real material, real people's lives and incomes. You can't squeeze more out of less in this type of environment. So the reality is that we, like every other humanitarian agency and UN agency, are going to have to reprioritize and do so aggressively. And that sadly means it's interesting, the list of countries that you were talking about, slow burn, they're actually in the midst of emergencies of their own. Sudan is the largest humanitarian emergency that we have anywhere in the world right now. DRC takeover by M23 of the east of the country is very significant. What we're having to look at is places like the Central African Republic, Burkina Faso, Cameroon, looking at how to handle Mali and Niger. These are longer term crises where there are meaningful humanitarian needs, there's meaningful food insecurity, but there isn't kinetic fighting at the moment that brings it into the news. So they're
Mhm.
being forgotten. We've talked for a long time in the industry of humanitarian aid about forgotten crises. Forgotten crises are one thing when there's money flowing, but when the money gets switched off, they get forgotten very quickly. They get deprioritized, and organizations have to leave. And my fear is that as we leave, we're forced to leave because of a lack of resources. That will catalyze even greater need, even more urgent need, and possibly even conflicts that will just have to go straight back again.
Well, Bob, we'll have to leave it there. Thank
On that
you for your
positive note, yes.
yeah, positive note. Is there any other point? Is there anything else you wanted to mention, you wanted to discuss or bring up? Like the floor is yours, sir.
No, I really appreciate you and your viewers and listeners taking the time to tune in. The situation in Myanmar is extremely severe, and it's what our attention is dedicated to. But so too is Sudan, so too is Gaza, so too is so many countries. It's a complex humanitarian train at the moment. So I appreciate you giving us your time.
Well, thank you, Bob. Thank you, everyone who tuned in live. Please do get a paid subscription to Global Dispatches so I can continue to bring this kind of story, these kind of interviews to you. Humanitarian journalism is my bread and butter. One of the only people who do this on a regular basis. And if you want to support my work, support Global Dispatches, please get a paying subscription. Thank you all. Thank you, Bob, and good luck.
Thank you.
All right, I will end this.